SLP. You address an auditory processing.
No, it's neurological. It's not language, right? So it's the inability to discriminate sound. So if all of a sudden I just started talking like this for the rest of the there are people that, well, that's irritating, but I can still listen to you, right? So you can drop me off at an airport. I'm so happy with some, Almond Joys and some beef jerky. The more sound I have, the better. I love sound. But there are people that truly cannot discriminate those sounds. And we see that in kiddos that whether they cover their ears, whether they struggle to acquire information, it's a very real thing, which is why if you have the ability, certainly go to a great ENT. It's great information. There's lots of medical conditions that my kiddos have that I then take as an advocate or one of our partners, and we communicate that to a team in a way that the teachers can understand how they can help the kiddos. And so sometimes there's this gap between needs, but we don't communicate it to the team, right? So if I come in and say, hey, my student has ADHD and dysautonomia, and they write down dysautonomia, which is an OHI, but nobody asks what that is, it doesn't really serve the student. So it's very important in my training. We teach all of you to write a robust, and I mean robust, present levels that are pristine, puffy, and prescriptive. And so we would need to include all of those needs, whether they're medical, whether they're from a therapist, whether they're, from the vacation Bible study lady, daycare. All of that information tells me about a child's unique circumstance. That's the last of Andrew F., March 22nd, 2017. That's the law of the land, the child's unique circumstance. A child is never an eligibility. I could have 10 boys that were all 6 years old, that all had autism and a speech impairment, and they all need something totally different. We need to lean into what the federal law says, their unique circumstances, and that's the totality of all that we've identified that's impacting their ability to learn.